Hello, and this is my oral presentation on my first semester of internship. I took 50 hours or one unit and I did it at a PT clinic. It was called Elite Sports Physical Therapy. And the field experience that I gained here was directly related to the field of kinesiology and to the courses I've taken, which I was tested on every day. Not even directly, but just by the nature of the work, by analysis of what was being done, what was being prescribed by the physical therapist, in seeing what they do and analyzing it, breaking it down, and understanding it, you see that everything we learned was not only necessary to know, but there's even more depth, obviously, as they progressed their education. So, you know, it was very helpful to really invest myself into these classes and soak in as much learning as I can because I see how necessary it is, right, to know everything that we learn from things like biomechanics, applied musculoskeletal anatomy, even exercise physiology, and so like even the smallest things like muscle insertions and origins, muscle actions, and every aspect of it is things that they just know by the like the back of their hand. And this experience that I got here is directly going to benefit my career. There's actually two paths I'm kind of stuck in between, or I can. There's a split in the road, I guess, crossroad where I guess I can go either way. Right now, I work as a personal trainer, which I may actually continue doing because I enjoy the work, and I've done it since 2018, so I've done it for a little bit now, and I can see myself doing this rest of my life and just continuing to expand my private business, that side of it, plus the gym I work at is Fitness 19. I can go to a better gym, a higher paying gym, and make a living in California just doing this. The other route I wanted to do or consider was going in medical, so becoming a doctor, but my plan is to become a holistic doctor, and so all aspects of health and wellness. I wanted to learn physical therapy because I really see it as very important, and there's a lot of issues that need to be solved that get solved here in this field. Now, not to say it directly will tie in to what I'm doing, but I just value the knowledge, and there's something that really just kind of pulled me into this space of physical therapy. Actually, before I even changed my major to kinesiology, I was very interested in physical therapy because movement is medicine, as they say, and there are things that need to be solved through proper movement and realignment of posture and correcting movement patterns. So I think it adds to my understanding of holistic health and wellness. But let's say I was even just staying as a personal trainer, the analysis and assessment at the depth they do in the work of physical therapy is much more extensive than what we learn as trainers. And my route, I have I guess three routes I can choose from here. Is a medical doctor, which was my original dream goal, which we'll see if that, if I continue that path. And I don't want to give up on it, but the next path would be stay as a personal trainer, or even become a doctor of physical therapy myself. The last one, I'm not really becoming a physical therapist. I'm not too sure if I want to do, but if the stars and planets align, then maybe that is what is in my fate. But I am interested in the work. I am interested, I should say, in the field of study, but I don't know if I will do that exact job, or if I'm not interested in that exact job. What may even happen is that I just continue my education in kinesiology and continue to the graduate level work, or even doctorate level. I go to get to my PhD because I enjoy learning kinesiology. it's been a great experience. Only hard part is balancing everything out with that in the rest of my life, which is why I haven't invested enough of myself into school as much as I'd like to. I don't have all A's, rightfully so, and I don't think I've mastered all the knowledge, which I would like to master it all. So maybe getting my master's is the next step. Kind of we'll see where things go, just how things line up. Um, but in terms of that last question, is the multidisciplinary approach uh, to kinesiology, how I'll strengthen my professional practice. That's exactly why I actually went into physical therapy as a trainer, even though in terms of multidisciplinary approach, using referrals and working in one field and using the whole web of healthcare, referring to nurses, doctors, physical therapists, their mental health specialists, whoever may be, is important. I think that a baseline understanding of knowledge of the depth that you get being a physical therapist, and being able to kind of extract a little bit of that from working in the field, without overstepping my boundary and stepping outside of my scope of practice as a trainer. I just have a wider field of vision, you could say, maybe, or there's maybe more I can see and analyze having this field experience. And it was something I was very interested in. It's something I really looked forward to doing, actually, was doing this internship in physical therapy. I've always wanted to work in physical therapy just to learn what they know. And so being part of the undergraduate program, I'm very happy to have taken this opportunity. It's been very helpful so far, and I want to continue doing this. So, I loved what it's been so far, how it's helping me apply what I've learned, and seeing the different aspects, the different disciplines, how they would come together. I see what it's like when trainers mess up, or people are negligent, either individuals as clients or patients, or individuals being trainers being negligent, can lead to people ending up in physical therapy, and how as a trainer I can prevent that through proper practice. So it has helped my practice a lot. The courses have been very relevant and extremely not even just helpful, but necessary. And I am very thankful for this experience. So thank you again, Dr. Carpenter.